Today we're going to talk about spine anatomy. I'm Dr. Malini Narayanan, a board-certified neurosurgeon who specializes in both spine and brain. I do this often with my patients, explaining the surgery. They're often interested in knowing where the surgery is going to be, why it has to be there, etc. And I think that this quick summary of spine anatomy may help so that you can see it a few times rather than just hear it once. This is a spine model actually from my residency. So it does have, it's lasted for a long time, just like our own spines do. And here's our cervical spine, thoracic spine, and lumbar. Specifically, there are 7 building blocks in the neck or cervical spine segments. And if we count that, this is actually C2, 3, 4, 5, 6, 7. This is a modified spine model, which actually leaves out the C1 ring. After that, 2, 3, 4, 5, 6, 7, we go to T1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 to T12, and after which L1, which is the lumbar segment right here, L1, 2, 3, 4, 5, and then the S1, which is sacrum. So sacrum, lumbar, thoracic, cervical. Depending on where your pathology is, where the problem is, will dictate different kinds of surgical intervention, if surgery is warranted or if it's an option. Specifically going through the anatomy, the front part, this is the front part, this is the back part. You can recognize the back part just feeling your own spine. The pointy parts are these spinous processes. The front part you cannot feel. In front of that is organs that cover the spine from the front. This is the vertebra. This is the spinous process, as you can see my pen pointing at. This is the transverse process. And this little portion is what's called a pedicle in the thoracic and lumbar spine. And these are the joints. And so really we can think of the spine as 3 joints. 1 joint on my left side, 1 joint on my right side, which you can see here and here, and 1 joint in the very front where the discs exist. So a disc is really a kind of joint. Depending on the pathology, if the disc is herniated, which you see here, you can actually see it from this model. This is the spinal cord going down the spinal column, which is being surrounded by bone, which is a beautiful design because the bone is protected in the spinal cord. When there is a herniated disc, especially in the cervical and thoracic spine, indicated by this white part herniating backwards, you can have spinal cord compression, or you can have nerve root compression, as this pink pen denotes where the nerve root would be traveling from. If, for example, your joints are hypertrophied over the years, that means overgrown with scar, it too can cause crowding of the spinal cord or crowding of the nerve root. And this happens at all the segments. Our spinal cord is filled with many neurons all the way down, much like an electrical cable, sending out signals through nerves to all the muscles of our body to initiate movement. In the lumbar, this bundle of spinal cord ends and sends more nerves traveling down the spinal canal called the cauda equina, and sending out more nerve roots to the lower extremities and to our ability to pass bowel or pass urine or be able to control it. So that's kind of a brief introduction to spine anatomy, and I'll be explaining in other videos the surgery that pertains to each segment. Thank you very much.